the station that's on your side. This is Channel 7 News Daybreak.
6:23 is the time. There's a new set of recommendations for people who have had a heart attack or who suffer from heart failure. Now, these recommendations say that these heart patients should add a fish oil supplement to their diet to help prevent future heart-related events. To break it all down this morning, we're going to talk with cardiologist Dr. Scott Davis from Baptist Health to consider this information. What exactly are we talking about, Dr. Davis, when it comes to fish oil supplements? There's several on the market right now, first of all.
I wanted to talk about this topic because it speaks to a bigger issue about the whole supplement issue. Now, specifically, there was one study that was done that looked at fish oil supplements in patients who've had heart attack, heart disease, and has shown benefit. But it's questionable as to the design of the study, and it's come under some criticism, and it warrants more research, right? Because we're an evidence-based process. In other words, we want evidence to show randomized clinical studies to show the benefit of certain medication, okay? And so when we look at fish oil, it speaks to the entire supplement issue that we deal with in the medical world, and that is the FDA regulates medications. The FTC, the Federal Trade Commission, regulates supplements. And those are two totally different worlds and two totally different bodies. The FDA puts medicines through a very rigorous process to prove safety and efficacy and that it works. The FTC is not a scientific body at all, but all of these over-the-counter supplements that you get, whether it's fish oil or St. John's wort or any other kind of supplement that may get over-the-counter at whether it's at Walgreens or at the gas station, are regulated by the FTC. And so it begs folks to stop and take a look at, all right, what am I putting in my body? And so the fish oil thing brings up this debate and this discussion about, all right, how well have we vetted this whole thing? And the fact that it may work and the fact that it does work are two totally different issues. And so we don't want to recommend anything that has some evidence but not solid evidence to be putting in your body. And so with regard to the fish oil piece, we've kind of let this thing roll down the road, and now we've gone from, well, there's one study that's benefited heart patients to, well, it might benefit everybody, so let's all just take it. And so instead of looking at the practical approach, which is the omega-3 fish oil, which is the beneficial ingredient, is in fatty fish like salmon. So maybe the recommendation needs to be, instead of taking a pill, which is kind of what we default to these days, instead walk past the steak aisle at the grocery store and pick up a piece of salmon.
Okay. And salmon also other benefits too, protein, other nutrients in it. So
absolutely.
The pills don't have that other stuff.
So it just begs us to kind of stop and say, wait a minute, what am I putting in my body here? And we've moved into this notion as a society of, well, the pill will take care of it, and we're not on the hook anymore for just being responsible about making good diet choices and exercise, et cetera.
All right, all goes back to those simple things.
That's
Dr. Davis, thanks so much for coming in. Here's the Baptist Health Healthline information, and their website is baptist-health.com.